Thank you. Thank you for taking our statements today, Minister. I suppose the ideal here is that we already own the site, that we already own everything about the co-located hospital, that we are able to build our national maternity hospital unfettered with having to negotiate with anybody else other than developers and keeping them in check. And I suppose in this, who do you trust? And given the legacy of the religious in relation to the care of women and children in the state in particular, I certainly don't trust the religious orders, and I think that has been overwhelmingly demonstrated in report after report and commission of investigation after commission of investigation. But who do I trust? I do trust government. I do trust our negotiators of the last number of years, and I do trust those who are negotiating in the here and now, that we do have a very fine, realistic balance here between having to get to a place where we have this hospital built, and there is a danger that the perfect becomes the enemy of the good, and we get delayed years and years more in the provision of services to women. So I am concerned about that balance, and that we don't have the ideal. We don't own the site. We are on the back foot. And if we start CPOing, then why aren't we CPOing all of the other hospitals? I too campaigned for repeal the 8th. I too held that belief of the rights of women to their bodily integrity and to make the choices and decisions over their bodies. But in that, here we are a number of years on. The Health Committee heard back in March that only 50% of the hospitals around the country are delivering all of the services that they should. Only 1 in 10 GPs are delivering the services. So I think we need a wider debate. Why aren't we CPOing the schools that are trotting out an ethos and an education programme that's contrary to the rights of parents and the complexity of families and the eclectic families at the moment? So there is a larger debate to be had on the whole role and severing that connection between the church and the state once and for all. And if we're paying for it, we should own it and we should have control.